Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is a COVID update. My co host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan. How are you doing?
I'm doing great, Faisal. It's good to be with you again this evening.
It's good to be back. I wanted to first start off by thanking Dr. Say Solomon. Dr. Say Solomon, thank you so much for coming in pretty much at the last minute. Close. He was on warning. My dad was in the hospital and he's recovering. He's doing very well. And I just appreciate how Dr. Solomon was able to come and host the show last week. I'll forever be grateful. And Dr. Dan, you, Drew, Jess, I'm so appreciative to you all for just keeping this moving.
Absolutely. At least I've been where you are, and I was, I think I speak for Dr. Solomon when I say we both wanted to do whatever we could to help you, and we were happy to help out any way we could.
Oh, I appreciate it so much. And to many of the listeners, I appreciate all your prayers. We literally received thousands of prayers from all different people from all different backgrounds, all different cultures, different religions, even some people who were atheists who were saying, "Hey, we're just sending good vibes," and we accepted. We received them all, especially through the hard times. I actually read them to my father when he was going through his hard times, and it really helped encourage him to push through. So thank you very much. Well, let's get on with the show. Dr. Dan, you and I both know that the COVID 19 vaccines work, but try telling that to half the country. I'm so thrilled to have ChenMed's own Dr. Jason Lane joining us tonight. Jason, welcome back, and thank you for coming to give another COVID update. And actually, let me rephrase that. I'm sorry that you're back having to give another COVID update. We were hoping that this was going to be like the victory lap tour.
Right. I think Jason is having some audio difficulties, but yeah, absolutely. I think when we scheduled this, we were really thinking about that this was going to be an issue, talking about COVID in schools and masking versus not masking.
Yeah.
We thought that the vaccines had pretty well move things down, but now we're seeing rises and, uh, I saw that I think it's New Orleans has more people in the hospital now than they have at any point during the COVID pandemic.
My goodness. Yeah. I remember feeling so optimistic with all the different vaccines becoming available and the numbers moving in the right direction. People started traveling again. We started visiting with each other again. Things just started feeling right. Like the end felt like it was in sight. I mean, what do you, I mean, I was going to ask Jason, and we can ask Jason when he comes back on. Jason's had some technical difficulties, but Dr. Dan, what do you think? Like, what do you think some of the things happen? Like, why is it that we're in this situation?
Well, we all started traveling. When was it? Back in May,
Yeah,
and I remember going taking the flight to Miami and that lots of empty seats on the planes, very easy walking through the airports, very few people there. But then in June, we my family made a trip out to Colorado and the airplanes were packed, the Denver airport was packed, all of the zoos, all of the sort of tourist areas were completely packed, and I think we just sort of everybody was tired and wanted to get out, and there was still a number of people that weren't vaccinated, and I think that just sort of started spreading it along. I think what we're seeing now with the immunity levels are that immunity seems to wane over time from the immunizations, and that's coming up with the CDC's recommendation to have another booster dose at this point as well. So I think there are a number of things. I mean, looking at some numbers today, it looks like the even sort of worst case right now. The vaccine is providing 81% protection against hospitalizations. If a year ago somebody had told us that they had a vaccine that was 81% effective, we would just be jumping for joy, right?
That's
I
right.
mean,
That's
and
right.
now we're upset. Well, it's dropped from 95% to 81%, though I'm sure we'll get it back up when we start doing the additional doses as well.
You know, I agree. I also worry about so many people around the world who still haven't received their first dose of the vaccine. And with COVID festering in these places and how connected the world is these days, I mean, of course, we have to overcome vaccine hesitancy here in our country, but with but with the pandemic still continuing in places where they haven't received entire communities of people who haven't received the first dose yet, I worry about what will come of all these variants and the mutations.
And if Jason has audio, I think that he's a much better person to be speaking about that than I am.
I'm not sure I have audio. I'm also not sure I'm a better person to be speaking about it, but can you hear me?
We can hear you.
Oh, good. I'm
Well,
so sorry
Jason,
about that. I was having difficulty with my with my speakers there, but I think we're good now.
Yeah,
we are. We are.
that's the fun of doing this live, if you call it fun.
Yeah. So Jason, we were just talking about how it felt so good just a couple months ago. We were all feeling so optimistic with all these vaccines becoming available, case numbers moving in the right direction. It all felt like, we could feel the end was there. And now what in the world happened?
Gosh, I've been thinking about this a lot. Right, just 8 weeks ago in June, it felt like it felt like it was kind of over, right? And it was almost like a feeling of euphoria. And
Yeah.
then for me, being down here in Florida, I think the first trouble sign showed up just a little bit before the 4th of July. And then it really started to take off in early to mid July. And then by the end of July, I really realized that we were in trouble again. And it felt a lot like it was March 2020 all over because things were moving incredibly fast. And they've continued to move incredibly fast right up to today with, bad news as far as Delta variant getting worse, but also I think good news with the realization that boosters are necessary, which I take as a good thing because we have the tools that we need to deal with this, and things are getting mobilized so that we're going to be able to use them. So just lots of moving pieces right now, kind of tough to stay on top of. I'm sure it's confusing to me. I'm sure it's confusing to to everybody. But yeah, it's kind of it's like what's that saying? Trying to drink water through a fire hose, right? Is kind of how it feels right now, and staying on top of this.
But one of the things that concerns me so much is that around the world there are still entire communities of people who haven't received their first vaccine yet. And I worry about these populations of people not being vaccinated and how connected the world is. Still, people are traveling. I mean, what apart from restricting travel? I mean, what else can we do?
I think the answer is we have to do a better job at vaccine equity, at making sure vaccines are available to everyone. But logistically, it's probably not realistic until we get into 2022, which means, I was thinking back to June. Let me think back to just May, when we were also getting that feeling of euphoria, but there were these news reports about this Delta variant over in India, right? And I was for some, I think maybe I didn't want to believe it was going to be a problem. Um, I think what it really is, at that time we were still vaccinating a lot of people every day. I think we were down from our peak of 3 million a day, but we were still vaccinating between 1 and 2 people a day. And I thought that we were going to vaccinate ourselves into a situation where new variants weren't going to be a problem for us. But vaccination fell off a cliff. We left ourselves very susceptible to what was going on around the rest of the world, and here we are. Now, I actually don't think, given what we're learning about Delta, I don't think that staying at that same vaccination pace would have left us completely immune to Delta. But I think it would have meant that we wouldn't have seen anything like what we're dealing with now if we'd stayed on that pace.